What's up, guys? It's Adam from Mediversity, and today we're going to be talking about our pelvic vasculature. This applies all our pelvic muscles and our gluteal muscles, and it's the major arteries in our pelvis, and it goes down and supplies the rest of our lower extremity. So let's get into our simple diagram before we get into our 3D model. Our abdominal aorta bifurcates into the common iliac arteries at L4, and it also has a median sacral artery that comes straight down. Our common iliac artery bifurcates into our internal and external iliacs at L5. And our external iliac is a major player of our lower extremity anatomy because it produces goes on to becoming the femoral artery after passing our inguinal canal. And it has two major branches, our deep circumflex artery and our inferior epigastric artery, which will anastomose with our superior epigastric artery as well. Our internal iliac artery will have two major trunks, the anterior trunk and the posterior trunk of the internal iliac arteries. Our posterior trunk is mnemonic is pills, and our anterior trunk's mnemonic is AIOI for our obturator artery, inferior gluteal, internal pudendal, and our pelvic branches. Our obturator artery will have our anterior and posterior branches as well, but those are small. I wouldn't worry about those. You want to know the main game players. And once again, our mnemonic for our anterior trunk is AIOI. Our posterior trunk is mnemonic is PILS, PILS, for lateral sacral artery, superior gluteal, and iliolumbar. Keep in mind, the posterior trunk has the superior gluteal, and our anterior trunk has the inferior gluteal arteries. All right, let's go see how this thing looks on the 3D model and see if we can find any of these arteries for you guys so you guys can see how it looks. Once again, we're doing the left side so that it stays consistent. All right, so this is our 3D model here. So we can obviously find the abdominal aorta really quickly, and it'll bifurcate into the common iliacs and that median sacral artery at L4. Now, I know I just pointed out L5, but it's at L4. And we have our median sacral artery. It's very small. And we have our common iliac artery right there on the left side. So the common iliacs, everything that's happening on the left side will happen on the right side. So you have your common iliac artery. And the common iliacs split and bifurcate into our external and internal iliac arteries at L5. So our internal iliac artery is right there where it goes into the pelvis, and our external is of course going external, and it goes on to becoming the femoral at our inguinal canal, which I'm showing you it goes all the way down that way with the femoral artery. So our two major game players are deep circumflex artery and our inferior epigastric artery. I also pinpoint and show you the superficial epigastric, which is a branch of actually the femoral artery. And once again, the external iliac artery becomes the femoral artery once it passes the inguinal canal. All right, so let's look for our internal iliac artery. So we have internal iliac, and we have two trunks, the posterior and anterior trunks. So I'm going to see if I can find the anterior trunk. That's the posterior trunk right there. And let's see if we get the anterior. So the anterior trunk, we're looking for AIOI. Really, the major game player is the obturator artery, which has two bifurcation as well. And it's going towards our obturator canal. The umbilical artery is a part of pelvic branches. And then there we go. That's the obturator artery right there. And we also want to find our inferior gluteal artery, which is right there sitting behind it. And it's shooting out towards our posterior side because our gluteals are in the buttocks area, and it's in the back of our, it's going posteriorly towards our body. All right, so now let's look at our posterior trunk and see if we can find our arteries here. So our posterior trunk, it usually, and sometimes it blends in, it becomes our superior gluteal artery, which is what's shown on this 3D model. Sometimes it's a branch. There's variance in between each model and cadaver model. Anatomy is different from person to person. But keep in mind, we're looking for our pills. So it's posterior trunk, and it has our iliolumbar, lateral sacral, and superior gluteal. So there's our lateral sacral arteries. And I think that's about it. I think these are all I found. But remember, you're having your pills for your posterior trunk, and then AIOI for your anterior trunk of our internal iliac artery. Our external iliac artery will go on to become our femoral artery. Like and subscribe. Thank you guys for watching with me.